Okay, well, today I'm delighted on the podcast to welcome Richard Hall. Richard Hall is Managing Director of PDM, and that's Product Design and Manufacture, based in the beautiful town of Thirsk in North Yorkshire. On Richard's website, it says that we find clever, innovative and cost-effective ways of taking concepts and developing them into useful products for the people who will benefit most. Richard, welcome along to the podcast.
Thank you very much. Thanks for inviting me. Looking forward to it.
Excellent. Well, you and I have worked together for a little while, and I'm always hugely impressed when I look at the work that you guys are doing. Very creative, very innovative. You've got a young team of sort of design engineers and designers who are fantastic. So I'd just like to go through a few questions with you and just understand sort of the power of innovation and design in the product development arena, really, if that's okay.
Yep, sure, fire away.
Okay, so you work across many sectors. I know one of the big ones is medical devices, but you do healthcare, automotive, consumer, retail, to name but a few. What do you think is the best journey for getting an idea right through to market?
Yeah, good question. I think, just to recap on what you mentioned, we do work in many different sectors, whether it's industrial or medical or consumer products. And it baffles people about how we can work on a medical device that goes into the abdomen, for example, and also a consumer product for retail. But the key, as you intimated, is the journey or the process. So innovation, design and product development is very much a strategic process. So it gets more difficult with disruptive innovation because there's not necessarily been a previously trodden path with disruptive innovation. The way we do it is we actually tailor the process to the product need and the challenge. So after being around for such a long time, we started out in 2005. Our strength is identifying the individual product and creating the journey for that particular product. So innovation by nature hasn't really been done before, so it's all new and new processes, new products, new services. So what we have to do is be very agile in terms of the process, understanding what the requirements are, what research needs to be done, and that kind of formulates the flight path for that particular product. So whether it is a medical device that goes into the abdomen or a nursery product, it's very, very much process driven. I think a lot of people think that design is kind of a process which is latter stages of innovation, where you try and work out what it might look like and how it might function. And that can be the case in some aspects, but with the stuff that we do, we have to really understand what the problem statement is and therefore what the design brief is. So it's very, in answer to your question, it's very, very much process driven. To create a really good, innovative product, it requires a lot of thought, a lot of process, and a lot of strategy as well.
Okay, and like any parts of business, process seems quite important. Is that a step-by-step? Does it matter what you're designing or manufacturing or getting ready for manufacture? Is the process pretty much the same then, Richard?
There are many design processes out there that if you can Google, you can find something called the double diamond design process, which kind of starts with something called divergent thinking, which is kind of effectively where you are free thinking, brainstorming lots of ideas, looking at technology, new processes, trying to lend technologies from other industries, for example. And that's kind of how we kind of operate. When we start a journey with a particular client, in terms of trying to explain the process, we kind of normally talk about the Gartner hype cycle. And if you kind of Google that, you'll see that it's a graphical illustration which kind of broadly plots the innovation process from start to finish. So you'll have this thing called peak of inflated expectations, where everybody thinks they've got a fantastic world-class money-making idea. But the Gartner hype cycle kind of tracks into something called the valley of death, and that's where people realise that actually having a good idea is only part of the process. I would probably say out of 100 good ideas, maybe 2 or 3% are successful, because there are so many things that need to align to make something commercially viable, protectable in terms of intellectual property, user-centered design, and something that actually makes money. So I think a lot of it is, there's lots of aspects to kind of product development, and I think people kind of misunderstand what product design actually is. Innovate UK, for example, have just recently spent quite a lot of money trying to highlight the importance of good design at the start of a process. So good design isn't necessarily designing a product, it's actually designing a journey and understanding the fundamental aspects and research which kind of informs the design process.
Okay, so obviously people are embarking on a journey because they've got this idea to change the world or make a fortune or build a retirement fund or whatever it might be, because they've come up with something great. In your experience then, where do most people or organisations hit the buffers on that journey? Is there one area that people are just getting wrong and that sort of derails them?
That's a really good question. I think part of it comes down to educating people and clients and prospective clients. In the actual kind of process of designing, the actual design aspect comes about halfway through. The first 50% is research, which kind of informs the design, as I mentioned earlier. I think a lot of people look at programs like Dragon's Den, of that kind of ilk, where they see that people have got an idea and effectively are trying to make money from it. And I think the fundamental aspects are that people are not informed or misunderstand the actual process. And what they do is they kind of leapfrog from having a really innovative idea. They've perhaps Googled it and found that it doesn't actually exist, and probably spoken to some friends or colleagues who've told them that, yes, that is a really good idea. But they've kind of fundamentally leapfrogged major aspects of product development and kind of found themselves in their mindset almost kind of selling products. I think a lot of it is down to understanding what the journey is. So kind of in answer to your question, when we meet prospective clients, I spend an awful lot of time trying to explain to them the actual innovation process and where the risks are. And if a client doesn't kind of understand, or they agree that they know what they don't know, then we'll probably not work with that particular client, because there'll be an awful lot of kind of dynamics in trying to explain a prospective client or a stakeholder team how we need to take it forward. There's an awful lot of trust goes into product development, and I think fundamentally you've really got to have a good understanding with a client and kind of trust each other, as with most businesses. But with product design and innovation, there is no kind of trodden path for that particular kind of requirement from that particular client. So it's very kind of, there is a lot of trust involved in this thing. I think for us, the way that we work is that realistically, when we do start on a new innovation or a product, we don't actually know if we can create a solution. But having the strategy and the process which drives us forward, and also the track record of projects which we've brought to market and things that we've developed and commercially viable solutions where clients are making money, it just demonstrates to clients that, we have got a good track record and we do know what we're doing. And a lot of it is down to kind of working very collaboratively with a client, and sometimes actually telling a client that their particular idea is probably a good idea, but it probably needs amending. So it's kind of a nice way to explain to a client there are other ways to skin that particular cat.
Okay, so being polite about that they're actually wrong is a real skill set when it comes to consulting with them, I guess.
I think so, because our motivation is to get products into market. So we do the usual 3D computer generated renders, and we have virtual reality platforms, which is really an interesting kind of thing that we have. But what really makes us tick as a business is to actually get products into market. So when I go into theatre and see products that we've designed being used, and I go into the high street and I see nursery products that parents are using, that gives me and the team a massive kick, and that's kind of our job satisfaction. And that is what we drive for with every product. Our intention is to get every product to market. And if it's not the right fit with a client, for example, from the outset, then I think we have a duty to ourselves to explain to the client that they're probably going to need a certain amount of budget and time, and a realization that actually they might need to take their hands off the steering wheel and let part of the team come in and the client would need to be agile to understand that there are lots of different ways to innovate. There are lots of different pitfalls, but you need to have the right team on board that can kind of take it forward.
Okay. Picked up on two things there. One, I've got a little story about Dragon's Den. I don't watch it anymore because it became a bit samey for me. But in the early days, it was quite an interesting sort of business program. Doing what I do, I'm looking for things I can use in training courses, etc. And I remember one guy came on and he'd invented, inverted commas, a piece of plastic that went on the end of a cucumber. And basically he said to the dragons who were sat there with all their money on the table, this is going to change the way people view cucumbers in the fridge. And I'm like, right, okay. And it was essentially a piece of plastic that clipped on the end of a cucumber, And I think Duncan Bannatyne said in his usual sort of fashion, why would I do that? And he said, well, it'll protect the end of your cucumber. And Duncan Bannatyne said, I just cut the last inch off and my cucumber's fine, thank you very much. And he said, use the phrase, congratulations, you've solved a problem that doesn't exist. And I presume you've got elements of that go on in your world where people are passionate about something because their friends have told them it's a good idea, but no one's actually had the sanity to say to them, nobody needs this thing.
Yeah. I think we do, when we first started out in 2005, we did kind of get a lot of inquiries from inventors and entrepreneurs, and there was a stark difference between the two. I think just going back to your cucumber, I think I did see that program. I think it was, the chap did create a solution to what you could argue is a problem, but he was trying to invent something that people didn't need. So the cucumber thing is really about user behavior. So it just kind of demonstrates that you can design a product, but if you haven't thought about the user, then it will fail. So in our studio in Thirst, we've got a Sinclair C5. A lot of people listening to this podcast probably won't know what I'm talking about.
They can Google it though, can't they? If they Google Sinclair C5 and see, it was the future of transportation in inverted commas in the mid-80s. It's hung on your wall, isn't it, in the office?
Yeah. And the reason why we've got the C5 is because you could argue that the Sinclair C5 was the first hybrid transport vehicle designed by Lotus. Technologically brilliant, one could argue. But the thing was literally 1.5 feet from the floor. And the concept was that the user would sit in the C5, which is at a very low height, and put their handlebars underneath their knees and kind of drive, pedal and or use assisted battery to get around town. So you could argue, it's a design solution, but the reality was that why it was a spectacular fail is because there was no research. Well, there probably was research, but there was no fundamental understanding of the user. So what we would do is look at the user. That is part of the holistic process from the outside. So it might be a good idea, but would the user actually use it? And so not talk to your friends about it, but go into the market, have some consumer trials, have some focus groups where people will tell you things that you do not actually sometimes want to know. But if you can learn that early, so we have a mantra, fail fast, fail cheap. So what we try and do, it sounds counterproductive, is we try and kill ideas early, because we don't want a client to spend lots and lots of money and lots of time on something that if or when they did launch it, it would be compromised and a failure.
Well, if you look at the Sinclair C5, the user experience would have been anything but relaxing, I would have thought. And particularly given these days, the size of lorries and so the size of, the buses and the double bendy buses and things in town. I live in York, which is a cycle city, and it's got cycle tracks and cycle paths. It may well just about survive that kind of journey. But you put that on a road next to anything like an SUV or anything above, and you would be absolutely scared beyond your wits, wouldn't you, really? Yeah. So it was never going to be successful on that basis, really, yeah.
The interesting thing is it's kind of a design icon now, for the wrong reasons, but we do have a bit of a soft spot for the Sinclair C5, which is why it's on our wall. It just reminds people when clients come in and they think they've got a good idea that we just kind of point at the C5 and kind of explain that lots of people have got good ideas, but if it's not, if you don't consider the journey, intellectual property, commercial viability, then there are higher chances of that particular product failing.
Well, going back to the guy on Dragon's Den, I do remember Peter Jones actually asked the guy, he said, tell me you haven't remortgaged your house to support the development of this product. And the guy just gulped as if to say, I'm not going to answer that question, but I suspect he may have done so.
Yeah, I mean, as I say, when we first started out in 2005, we did get approached by lots of kind of inventors, and we have a filtering system. We actually don't really work with inventors, and we haven't done for quite a long time. We work more with SMEs and spin-outs from universities and PLCs and manufacturers, and usually the need for the product has been defined by the account managers or the salespeople that are on the ground talking to their particular clients about something which is new or needs to be innovated or disruptive. So we tend to work with kind of, spin-outs that have got a really good technology, or companies that have been around quite a long time. So it's kind of, but the process of innovation is still very, very difficult because, everybody in industry wants to be the best, whether it's having a product which is cheaper, more agile, has got more functionality. Everybody's looking for their USP, and innovation usually kind of drives that. So we'd usually work with a client that actually knows what their deliverables are to be. And I don't think there are lots of inventors out there that actually aren't inventors. They are entrepreneurs, but they like to kind of call themselves inventors. Normally with us, an inventor classically won't necessarily be able to get a product to market because they don't have the entrepreneurial kind of spirit.
Okay.
And so we have a really good filtering system from the outset when we get inquiries. Usually those questions are, where are you with your intellectual property? What's your route to market? What are the competing technologies? What budget do you have? Those kind of questions. And if somebody can't kind of answer those questions, kind of with authority, then we will kind of ask them to go and do some more research or go and see an IP specialist or go and talk to an organisation that might fund some early stage kind of conceptual development of a product.
And there's funding around for those kind of things in the UK, is there, Richard, for sort of idea generation and qualification then?
Yeah, there are various kind of funding pots out there, but as you would expect, they are very, very difficult to access. So here in the kind of Leeds City region, there's the Local Enterprise Partnership, LEP, and they have some programs called Access Innovation. And they have funding of something like 30% up to something like £25,000, I think. There are other funding pots out there. There's something called Spark Fund, which is from University of Hull, which I think is around the same kind of region. There is also something called Economic Growth Solutions, which was kind of a reincarnation of what was called the Manufacturing Advisory Service, which I think is something like 10K, which is something like 30 or 33% funded. But as with most things, they won't fund ideas. They would want to see that whether it's an inventor, an entrepreneur, or an SME or a manufacturer have done their kind of groundwork, because there is an aspect of risk to any funding which is kind of appropriated. But there are things out there. But for us, I think we need to know that the client, whether it's an SME or a spin out or a manufacturer or PLC, are absolutely committed to making it a success, because I think a lot of the thing about innovation is that a lot of it is down to the people. If you've got a really good team of people that want to kind of move mountains and innovate, then you can actually do some great things. If there is kind of a conflict of interest or the wrong management team around it, then it's always far more difficult to try and get good solutions.
It's going to hit the buffers at some stage, isn't it, on that basis, because of politics or lack of internal buy-in or those kind of issues. Yeah,
there's got to be complete buy-in from the outset. So we spend a lot of time at the start of projects strategizing, looking at risk, getting people's buy-in. So fundamentally, we all understand what we're trying to achieve.
Okay. The British have got a history of being great inventors. You use the word inventors, but entrepreneurs as well, particularly in product design. If you can, without breaching any confidentiality issues, do you want to share with us some of the sort of products and fascinating sort of design aspects that you've delivered in terms of getting products to market? Because when I come into your studio in Thirsk, you're always designing things that look like they're going into people and operating. It's quite a... I'm always wondering, what does that implement do? Have you got some interesting stories of things that you might have done over the years?
Yeah, so since we've been around, we've designed lots of different products, nursery products, medical devices, healthcare, industrial, and we've worked with the likes of Recaro and Network Rail. But I think what we really enjoy is medical device design. To design a medical device that goes into somebody's body, you've really got to know what you're doing. So I would like to think that because we work on a lot of medical devices, that it kind of demonstrates that we're a safe pair of hands. So the things I can think of over the last kind of 14 years is probably one of them is obstetric forceps. So we were approached by the NHS to help with creating a device for assisted delivery. So without trying to go into a lot of detail, there are two types of assisted deliveries.
Well, hang on. Some people might be eating their lunch or having their breakfast, Richard, while we're listening or watching this podcast. So keep the details as vague as you can on that one.
So one is ventouse, i.e. suction cup, and the other one is forceps. They've both got features and benefits, but there's no one kind of medical device for assisted delivery which has got the efficacy of both. So we were commissioned by the NHS to look into it, and fast forward a couple of years, and we designed an obstetric forceps which has got a traction device that allows the obstetrician to understand what kind of traction they are using when they are delivering a baby. There is a point in time when you have a traction force or a pull force when you're doing assisted delivery where it becomes traumatic to the mother and the baby. So this is a device that allows the clinician, the obstetrician, to understand at what point they need to stop on the traction and convert to a C-section. So we're really pleased about that. Another one
that's probably saved some lives in its time, Richard, hasn't it? I would have thought.
I would think so. It kind of makes the whole process safer. So if you roll back, the obstetric forceps were invented in something like the 18th century, and they've not really changed since. It's a very kind of raw method of delivering babies, but obviously it works. But the problem was that there's no way of knowing. If you imagine you're an obstetrician and it's 3:00 in the morning, you've been called out for a kind of to help with assisted delivery, and there's lots of adrenaline flying around. The obstetrician doesn't actually know whether it's a large obstetrician or a petite obstetrician. You don't actually know what kind of traction force you are applying, and so things like that really kind of interests us.
Excellent.
Another one which we're working on at the moment is something called Global Health. So it's funded by the National Institute of Health Research, which is the research arm of the NHS. And what we're doing is working with some academics and clinicians in the UK and also in rural India, so in West Bengal. And the essence of the project is to help create a laparoscopic medical device which increases the chances of recovery after abdominal surgery. So if you think that at the moment in rural India, if somebody's got a problem in their abdomen, whether it's gallbladder or whatever, a rural surgeon with a pop-up surgery will have to carry out open surgery, and the risks of that are quite significant in terms of infection control. So what we're doing is we're taking best practice of lap surgery in the West and trying to apply it to rural India. It's got its own challenges in terms of the availability of CO2 to insufflate the abdomen, so blow the abdomen up. But we're just working on a device that will kind of which can be deployed in rural India. Now, for us, that is real, raw, and it's a very humbling project because in rural India, if you can't work, then you can't feed your family. It's as basic as that. So we're going out to India in November to go and do some trials and meet some more surgeons. So we do transactional kind of projects for the likes of Recaro and Network Rail, but they're ones that really kind of make us. Job satisfaction are things like medical devices, because they actually do make a difference to people's lives.
Excellent. Okay. Well, you've got a young, talented team at the studio in Thirsk, haven't you, really? Quick question, it's not really relevant to innovation, etc. Do you recruit for talent? Do you recruit for sort of design experience, or do you recruit for attitude? How do you get your team? Because they are young, they are dynamic, and they're pretty fresh when it comes to the sort of business world, really. Yeah,
good question. To recruit good designers who have the right skill set is incredibly difficult. The way that we do it is we look at the talent from kind of design courses across the UK, and there are exhibitions called New Designers, which is every year down in London, and what we tend to do is try and recruit the best of the best. You don't really know until you actually employ somebody, but what we're actually after is raw talent. So skills you can actually learn, but what we recruit are people that are passionate about design. They live and breathe it, as everybody in the team does. They're inquisitive. They want to make a difference. They realise that design isn't necessarily having a brief from a client and jumping onto a CAD, onto a laptop and creating a product and then trying to justify why it's the shape it is or how it functions as it does. So what we need is people that are inquisitive, that can go into theatre and observe a medical operating procedure and see what the context of the problem is, and to be able to articulate what the potential solutions might be. So
Okay.
it is incredibly difficult to get the right kind of people, and that's kind of how we do it. And I think, you know, we're a small team, and we're a small team because I want to keep it a small team. I don't want to be a large business that has account managers, because what we like to do is have, you know, first-hand experience of working with clients, and part of it is the journey, part of it is the passion of working directly with the client all the way through the journey.
Okay, so you also recruit for strong constitution and things if they're going into theatre to watch. I once rang you and you said, "I can't take your call, Nick. I'm in theatre." I thought you were watching The Greatest Showman or something of that nature. Then I worked out that you were actually watching some kind of open surgery with some forceps delivery or whatever. And I quickly put the phone down. So there's an interpretation of that. So when I meet your team next time, I guarantee they've got a strong constitution on them, have they?
Yeah, we've seen a lot of procedures. So we're working on several medical devices at the moment.
Yeah.
And, you know, I think the key is you've really got to, and we also do cadaveric trials. So the way that we validate a concept or an innovation is we have to use cadavers to trial the process, because obviously you can't design a medical device, obstetric forceps, for example, and then use it on a live person. You need a mechanism to try it, right, to demonstrate that it is fit for purpose. Yeah. So we do all sorts of, we do all sorts of different things, but I think the key is that you've got to really, you can't design a product in isolation and take from face value what, for example, a surgeon will tell you what they think they need. You have to actually go in and observe firsthand the context of the problem, and that way you've got a much better chance of creating a solution, because sometimes as product designers we can see things that clients can't. So it's a classic kind of, you know, usability study that we do. I
did ring you once as well, and you said, don't worry, no one's looking because they've got no heads on the cadavers because the dentistry school have taken the heads. I mean, I'll be honest with you, that's a different world to where I operate, and it did make me feel a little bit queasy. I'm not sure I could fit on your team from that perspective.
No, I think part of it with the medical devices, it's a very obviously a very serious business, and we take things. You know, to design a medical device, you've really got to have a set of skills, and I do actually see it as a privilege. Yeah. Because the end game to all of this is to work with the cadavers to actually make devices that are going to save people without sounding cheesy. You know, making a difference to and potentially saving people's lives. You know, and that's the reality of it.
Well, the Rural India project is an absolute example of that. You know, you were making a massive difference to the surgeons and to the people that they operate on. So that must give you a lot of pride, as you've said. I've got a question about kind of what's next, really. Innovation is one of those things that, by the very nature, it hasn't been invented yet, for example, and innovation is part of that process. But in your studio, you've got 3D printing, you've got virtual reality suite. So what's next, really?
Yeah, so in answer to your question, we are passionate about innovation. That's our thing. And I would like to think I'm an ambassador for innovation as well. So
you're involved on a number of bodies, aren't you, for that, in terms of the sort of representative of the industry and the sector? Is that right?
Yeah, so I do various kind of, as well as running the business, you know, kind of consultancy roles and assessing applications for funding, etc. And I've been a mentor for the Design Council. I'm also a fellow of the Royal Society of Arts, if anybody knows what that is. Okay. So yeah, innovation's our thing. So for me, it's about the process of making products and services better. So for example, we kind of invested in 3D printing about 8 years ago before it became a thing. We now have, I think, 5 3D printers in the studio. 3D printing is really a tool. It's the same as being a screwdriver or a hammer. It just allows us to do a better job to create products quicker, compress the lead time. It allows us to articulate initial design thinking to clients because we can show them a 3-dimensional prototype as opposed to trying to explain to a client using a sketch. So 3D printing is very powerful. In terms of other stuff that we've got, so we invested in virtual reality about 4 years ago, and that again is about experience design. Rather than make a huge prototype and then trying to explain to a client how it might work or function, we can create design solutions virtually and then put them into our virtual platform, and then we can put the headset on the client and then they can literally be in that VR world. And the beauty of this is that it's far cheaper than making physical product, but because the client is put in the virtual world, the feedback is different because they actually think that they are stood next to the next kind of the product which we've created. They interact far, far better, and you can get some really good kind of feedback from VR. In terms of stuff that we're looking at the moment, so we're looking at having more in-house capacity for our workshop. So we're looking at laser cutting machines, CNC machines, so things that machine from blocks. So it's subtractive manufacturing, and also 3D scanning. So we've always got a finger on the pulse. 3D scanning used to be pretty expensive, but it's now starting to become mature where we can actually perhaps adopt it and use it in our studio. Other things that are out there are 3D printing of metal. That is still becoming mature, but it wouldn't surprise me in the next kind of 5 years we'd probably invest in a metal 3D printer.
Okay. So a lot of investment to keep ahead of the game and to make sure you're providing the options for your clients to, I guess, see their product before they've invested too much in, like you say, manufacturing, tooling costs, etc. Those kind of things.
Yeah, and it's a very, very good strategic process because what we want to do is validate design thinking right the way through the process. The worst thing that you can do as a designer is assume the design brief and assume that you've designed a product which is fit for purpose, and then you manufacture an expensive finished prototype which looks like the real thing, and then you present it to the client. That's a dangerous place to be because the client might say, that's not the size I anticipated it to be, that's not how I expected it to look, that's not how I expected it to function.
It's the wrong shape, it's whatever it might be.
Yeah, so we use 3D printing to validate early stage design, so kind of early stage functional prototypes, because when you go into 3D and VR, it's got a really good feedback loop to iterative design process, and that's the way. So we're always looking at technologies which we can adopt if they are appropriate.
Okay. One final question for you. Let's assume I've got a product idea. It doesn't matter what the area of product it might be, whether it's medical or whatever. One piece of advice you would give me if you're looking to say, okay, you got an idea, but you want to make it commercially viable, and that's really important. I just don't want to make a product. I want to make sure that product is accessible. One piece of golden advice you give me is from your experience and background, Richard.
Try to kill it early.
Excellent. Okay. Interesting way. You've got an idea. I'm just about to shatter your dreams early. But if you say fail early, fail cheap, is that
So it is counterintuitive. So I mean, say we work with clients that know what they want to do and the reasons why they want to do it. But you need to kind of validate early stage. So and in a nice way, you need to look at points of weakness of your particular innovation, not to try and kill it holistically, but look for areas of weakness that you can improve on. Okay. Because otherwise, you want to learn points of weakness in a particular innovation or a product in the early stages, not when you spent lots of money and showed it to your first focus group. So it sounds completely counterintuitive when we say to clients, we're going to try and kill your idea.
Yeah.
But that's our responsibility as a business. That's what we want to do. We want products to be a success. And the way to do that is to look for points of weakness early on, because then we can tackle them and get solutions.
Excellent. Well, Richard Hall from PDM, it's been an absolute pleasure. I hope the audience who are viewing and listening have got some ideas, and hope those ideas don't get killed too early in the process. But we'll put your contact details on the podcast information. Everyone wants to talk to you about their ideas. You prefer to be entrepreneurial and inventor, so any inventors are okay, but if they're entrepreneurial, that's better for you and better for them. So, Richard, pleasure. Thank you for attending the podcast.
Thank you very much for inviting me.